Tip Edge Plus brackets from TP Orthodontics are the next generation of the Tip Edge technique and allowed the clinician an unprecedented combination of outstanding results and ease of use. If you're a longtime practitioner of the Tip Edge technique, this brief tutorial will help you become acquainted with the updated method of use in stage 3 of treatment. If you're relatively new to the technique, you'll see here how easy it is to use the unique Plus treatment method in the final stage of treatment. Either way, we're confident you'll find that Plus delivers excellent results and makes treatment simple and more comfortable for even the most complex cases.
The first thing that's done is the 022 wires are removed. Now these wires, it's very important that these wires had molar offsets in them prior to this appointment. It makes it much easier to get the rectangular wires in. Easiest thing to do is to take the previous wires and use those as a guide to the cutting these to the proper length. You want your underwires to be a little bit longer than the previous wires. It's important these wires had molar offsets in them. It's going to make it much easier for us to engage the rectangular wires. We've selected a nickel titanium wires, upper and lower. These are the TP reflex wires. And we're just going to use the wires we took out to roughly determine what length to cut these off. We cut them a little longer than the 022 wires to be safe. With the nickel titanium wire, we start at the mesial of the central incisors. Usually just bring around one end each way. Now these are beveled. The deep tunnels are beveled, so it makes it very easy to thread this wire even if there has been a lot of tipping of the teeth during stages 1 and 2. Now Hannah here, her treatment plan involved the extraction of upper second bis and lower first bis. You can see we just grab the wire. The first bicuspid is tipped distally, so we want to be able to bring the root this way. We want the root to come this way, so we want to have a vertical. We want this wire to be over the occlusal surface of the tube here. That gives us the vertical lift we need to help kick the root of the first bicuspid distally. As we finish threading the wire, this little circle starts to flip on us. You're seeing it flip right here. And then when you get it completely threaded through, it'll just pop straighten out. Now we'll trim the ends with distal cutters. Like I said, about halfway, just right in the middle of the tube. There. The lower is threaded the same way. This is just standard reflex nickel titanium wire. It seems like this wire is flexible enough to thread through without being distorted, so the advantage of this standard nickel titanium is it has more kick for uprighting, and this wire will also torque as well as upright, since we will be using full-size rectangular wires in the main arch wire slot, and when the teeth upright, that slot will close down from 028 to 022 and generate torque from the main rectangular arch wire. Once again, then we just go ahead, finish threading the wire, and then the circle in front will take a flip. And then we're straight. And now we're all the way in. Wires just needs to be cut flush at the end of the gingival tubes. So once the nickel titanium wire is engaged, we will go to our rectangular wires. These are full-size 0215 by 0275 with sharp corners. You want to have the sharp corners on these to produce better torque. Once again, we take the old wire, the 022, and use that as a guide as far as where we want to trim these ends off. We tend to cut them at an angle like this. We can angle our distal cutters to get a bevel, which will make it easier to engage. And then the same with the lower wire. To get a better idea as far as the proper length of the wire, we can often just do a trial fit. We just take the wire, engage it in one bracket and tie it in place. It's not, we don't engage it in the tubes yet. So with it engaged in this manner, we can go ahead and trim the ends up to a little bit better, get a better idea as far as where we should cut the ends. Now the next thing we will do before we actually tie her in completely is just select a crimpable hook. These are special pliers that have extra long handles that allow you to crimp these hooks on really well. So this is a good time to go ahead and crimp these in place. They go between the lateral and cuspid brackets. And then we'll mark our bends that we're going to place here to compensate for the short crowns, help bring this tooth down. Then the last thing that we do is take a heatless stone and then bevel the rectangular wire, the inner surfaces of the wire, to allow it to slide into place a little more easily. After the wires are beveled, it's very important to anneal them. We used to use this slider, and it's a little refillable butane lighter, just to touch the very ends, the last few millimeters. We want the ends of the wires to be long. They have to extend out the end of the tubes. Can you open, please? Can you open the end? Sometimes you have to just de-torque it a little bit, or adjust the torque a little bit to allow it to slide the rest of the way through the rectangular tubes. Now the last thing before we tie the wires in is to bend the ends of the wires. Open please, Hannah. You like to have a little, you don't want to bend the ends, cinch them too tightly, because the teeth do need more room mesiodistally as the upright. So we have a little bit of space here, which is good, so I can bend that wire straight down here. But if they were bunched up tightly, we would make sure to leave a little extra wire between the end of the tube and the actual bend, which is what we're going to do in the lower right. We don't have any space present in an arch there. The upper right, we have a little space, so we can just bend that straight down on the upper right. And the upper left is also, we have a little bit of space there, so we'll just bend that straight down. We take the sticky ring here and just use that with the straight shooter to finish tying her in. We always tell the patients this is the most dangerous stage for not wearing rubber bands, because if you don't, the torquing of the incisors will just bring the entire upper arch forward and you'll end up back in stage 1. So we try to emphasize that at this visit. We twist them a couple of times. We use the light Dontrix gauge. We want about 1 ounce, 1 or 2 ounces of force. So with the Dontrix gauge, we just measure, and here we're getting about 1.5 ounces of pull, which is plenty. So she'll just check her bite every morning. Bite down, hon? She has a little overbite, so she knows to wear those rubber bands today. Now, we tell our patients if they get edge to edge in front like that, she knows she doesn't need to wear them. So she's all set.
With Tip Edge Plus, Stage 3 is simpler than ever. To find out more, visit www.plusbrackets.com or call 800-348-8856.